My particular area of expertise is in transplant nephrology. So I see patients following a transplant, pre-transplant, and donors pre-transplant as well. Our job is to educate the patient, educate their families, prepare them for what's likely to happen down the road, and try to anticipate what may be important issues for the patient and their families downstream. The philosophy really has to be one of education, patience, and foresight in trying to determine what the best course of action has to be. In transplantation, a good care of a transplant patient requires a combination of both surgical and medical skill. So we have surgeons who do the actual transplant surgery and are intimately involved in the transplant program, and we have nephrologists who do the medical management of transplant patients. That involves areas such as adjusting blood pressure medicines, taking care of chronic illnesses like diabetes and hypertension, and paying particular attention to long-term complications of things that we do today and tomorrow. I went into medicine mostly because of my family doctor, and I grew up in a very small town in Upper Michigan. So there were probably less than 10,000 people in this town, and there was no stoplight for 2 hours. The doctor we had was an old-fashioned family physician who was everything to everybody and would show up in the emergency room regardless of what was happening, regardless of when it was. I don't think very many people practice that way anymore, but he established sort of this norm or this ideal in my head for what a person could be as a physician. I remember him particularly asking questions about my life as it framed my health. So he wanted to know what kind of sports I was involved in, or how I was eating, or general things like that. And I think those are questions that help you better define what kind of needs a patient might have. Understanding their personal life and what their own habits are really, or getting to know them, really help you know what you need to do to optimize their health. One person may exercise a lot, another person may not, for whatever reason, and that changes how you approach them.